Educating your patient on the Viking. You've identified that your patient has a BMI of 50 or greater and is a candidate for the Viking. The hover mat is already on the bed. Preparing your patient includes the Viking handout and answering any questions about its use and placement. Preparing your patient ahead of time may help decrease any anxiety she may have about its use.
Hi, Mrs. Liu.
Hi there.
Hello. We'll be pushing soon, and just wanted to know if you had any questions about the Viking. We'll be bringing it in. And do you have any questions about the pamphlet?
No, I don't. Not at this time, but thank you.
Okay, you're welcome.
Arranging with the charge to obtain the Viking.
Hi, Tammy. This is Jennifer. I have the patient in room 204 whose BMI is 60. She is now 8 centimeters. I'm going to need the Viking and a second nurse or BMI buddy to help position my patient soon. Can you help arrange that for me?
Sure, I'll have Elena go to the ER and pick it up. Hi Elena, this is Tammy. I'm calling because Jennifer's patient in 204 is now 8 centimeters and her BMI is over 60. Can you please go to the ER and pick up the Viking for us? Thank you. Hi, this is Tammy. I wanted to let you know that Elena is going to the ER to pick up the Viking. She should be back to our unit within 30 minutes.
Thank you, Tammy.
Until labor and delivery has its own Viking, it's important to call the ER ahead of time to make sure the Viking is available and notify them you have a patient in labor and delivery who will need it.
Hi, Tammy. This is Jennifer. I'm ready to start pushing with my patient. Can you help me set up the Viking and position my patient?
Sure, I'll be right in.
Thank you. Hi, Mrs. Liu. This is Tammy. She's going to help me position you for pushing.
Hi, Tammy. Thank you for helping. No problem. Okay.
Before bringing the Viking into the room, obtain the straps from the B24 stock room. Raise the bed to waist height. Place the straps underneath the legs. You will be using a pillow, placing it lengthwise along the patient's legs. The stirrups into position and lower the bottom of the bed to the lowest point. You are now ready to bring in the Viking. When using the Viking, make sure it is positioned on the family side of the patient's bed.
Thank you, Elena.
Lock the wheels. Make sure it is not plugged into the wall and that the red button located at the base of the Viking is in operational mode. That means it is pulled out. When the Viking is plugged into the wall, it is in charge mode and is non-operational. Key points when positioning the Viking. Make sure that the base of the Viking is in front of the break of the labor bed. Inform the provider that the other side of the base will be in front of the labor bed so that they don't trip on it. Attach the leg straps to the Viking at the lowest point, the triangular base. Use the Viking to lift the legs into position. You will have to adjust the stirrups and the straps to the correct angle. Assess patient's mobility and make sure her legs are not pinched in any way by the stirrups prior to getting started.
Ms. Lou, do your legs feel okay?
Yes, they do.
Thank you.
Because the legs are suspended, patient may be able to pull back on her own legs during pushing. Family members often want to help during pushing. Again, the Viking has suspended the weight of her legs, and supporting the patient's foot is a safe way for them to participate. You are now ready to push.
Mrs. Lou, how do your legs feel in the stirrups?
They feel good. They feel okay.
It is important to promote circulation and relieve any strain to the patient's hip flexors by bringing the legs together and down every 30 minutes during pushing.